I'm Dr. Ashok Rajgopal. I'm the Group Chairman of the Department of Musculoskeletal Diseases and Orthopedics at Medanta Medicity, Gurugram Hospital. Arthritis is more common in women for two reasons. One is because rheumatoid arthritis seems to be more common in the female population. Obesity is one of the common causes of osteoarthritis and degenerative arthritis. In addition, the incidence of hypothyroidism is also higher in the female population, which accounts for a higher incidence of arthritis in this segment of the population. So the warning signs is pretty basic. Most of these patients will start to complain of pain. Initially, the pain is episodic, it is sporadic and occasional. If it's not heeded, sometimes in these patients, the incidence and the gravity of pain increases, and over time, this causes a major disability. Pain at rest is always an indication that something is not right with your joints. In the non-weight bearing joints, again, night stiffness, night pains are an indication for arthritis. And these are the patients who need to consult with their doctors for preventative measures and for the treatment. In women, particularly patients who are obese, weight loss is critically important. Good body health, good bone health is important. So they need to take a balanced diet high in calcium and in proteins. Control of diabetes is very, very important. Control of their hypothyroid status, if they are afflicted with this disease, is of critical importance. Most importantly, having a healthy, balanced lifestyle with good diet, wholesome diet, and taking care of the calcium intake is of critical importance. It's also important to mention that around the menopause or the perimenopausal age group, there is a loss of the calcium content within the bones because of the hormonal imbalance. So it is particularly advisable in the female population around this perimenopausal segment to take care of their bone health, consult with their doctors or their internists, and make sure that they have good calcium content in their bodies. So by and large, the commonest form of treatment for osteoarthritis is having a good posture, having control over their medical conditions like diabetes, thyroid, weight. Most patients with arthritis will respond extremely well with conservative measures like physiotherapy, physical exercises, walking, yoga. These are excellent methods of controlling the pain and the disability. It's only a very, very small segment of patients, roughly about anything from 10 to 12% of patients who will go on to needing intervention. So if common measures like medication, ointments, heat applications, yoga, etc. does not relieve these patients of their symptoms, it is advisable to seek a consultation with an orthopedic specialist or a physical therapist. Most times the physical therapist will introduce various forms of exercises, various forms of heat treatment like laser, IFT, ultrasound, and shortwave diathermy. A majority of these patients again will respond very favorably. If it still does not respond, then the orthopedic surgeons would try a course of anti-inflammatory medication like paracetamol, naproxen sodium, Voveron, and other forms of anti-inflammatory drugs. And an extremely small proportion of patients will actually come to needing surgery. This percentage could be as low as about 5 to 7%. There are various forms of surgical options available, starting from very minimally invasive options like arthroscopy, which is a small keyhole surgery. In the event that there is some malalignment of the limbs, some forms of realignment surgery can be done, and an extremely small proportion of patients will end up needing joint replacements, which again in today's day and age is available in the form of either a partial or a total replacement. Outcomes of replacement surgeries are excellent. Most of these joints will last for up to about 20 to 25 years. In the weight-bearing joints and in the joints like the shoulder and elbow, the outcomes are excellent at between 15 to 17 years.